schedule. So we're going to get this started without wasting any more time. Um, this is the third session, by the way, and I would like to invite Senior Optometrist Mayur Varia to the chairman's table, along with Senior Optometrist Rani Obesekara. Please, can you all make your way to the sessions table so that we can start with the sessions? And can we get the lights as well, hotel staff, if you don't mind? And if you can off this light. Okay, so next it is my pleasure to introduce our next guest speaker. She too has traveled from India to be with us once again, and she's certainly no stranger to our community. For many years, she has been active participant in our scientific sessions, and we are honored to have her with us again. Please welcome the Head of Education at Lanka Luxottica, Mrs. N. Anant Lakshmi. Ladies and gentlemen, please put your hands together to Ms. Anant Lakshmi. Can we get the lights on as well, please? No. Can we stop the music on that side, please? Thank you. Sorry for that, Ms. Anant Lakshmi. The stage is all yours. You can begin now.
Oh, okay. Okay. I'm supposed to say good afternoon to everybody, but I stand here telling you all good evening. Okay. Good evening, one and all. Good evening. Not after that session, right? Good evening. Okay, great. So what I'm going to talk in the next 10 to 15 minutes is on the topic game-changing solutions in spectacle lenses. So why do you actually need a technology? Why do you need solutions? The reason because we are living in a highly dynamic environment. We need solutions which can cater to the everyday lifestyle, should not disrupt our performance, and should complement our day-to-day activities. And this all actually means that there's scope of development day by day. And today we are going to talk about a spectacle lens, which is actually going to be a very safe option, is also a non-invasive technique, and is an option which is chosen by many in terms of vision correction. So when I'm talking about spectacle lenses, are we just dispensing lenses based only on optical purposes to correct refractive error? The answer is a big no. Your spectacle lenses can do even more than that. It has got a lot of value enhancements like coatings, light management, polarizing techniques, and so on. So what is the expectation of a customer who enters your practice? You know, when he buys a pair of spectacle lens from you, it's just not that he wishes for a good, I would say, sharp vision through his prescription, but he also wants a solution for whatever problems he's facing, basically vision through his spectacle lenses. And that's exactly where our role comes in. When he comes to buy a spectacle lens, it's our duty to speak to him about what is available, the best options available in spectacle lenses, after hearing his lifestyle, his hobbies, and so on. So it should match his lifestyle and hobbies. So basically what we are trying to tell you is we have so many solutions, so many baskets of solutions available today. You need to have the right match between the customer and the right solution. I think that is what is very, very imperative in a successful practice. So moving across, today I'm not going to talk too much. There are so many technologies available. I'm not going to talk about all those technologies. I've handpicked just 3 basic technologies which I believe could really be a game changer, could really help you in your practice to ensure that your customers are very happy. So before I go on to these technologies, I believe that every customer who enters your practice has something to gain from your practice. So normally we are always skewed to one category of technology, either it's for the kids or either it's for the presbyope. Okay, so today I made it very clear that you have technologies for every customer who enters your practice, and we have 3 categories of people who actually will enter your practice. It could be kids, it could be kids and children, it could be adult teenagers, or it could be presbyopes. So I'm actually dividing these 3 technologies, one key technology for each of these categories to make it very short and clear for you to go and implement in your practice. So let's begin. Let's begin with technology which is basically for children. So what is it? I'm sure you've been hearing a lot of lectures from morning talking about myopia progression being a very important issue in the coming days. So it's again a very important thing. So just to answer this question of is myopia progression a new thing? Definitely no. Okay, I actually graduated about 2 decades back, and even that time we knew that myopia was progressing. Did we have a solution? The answer is a big no. You know, we try to manage myopia progression with a lot of vision hygiene solutions, but today that is not the case. We have a lot of solutions to manage myopia. So in the last 2 to 3 decades, we did have from time to time various solutions for myopia. However, those things were not being embraced by practitioners across the world. The reason could be is there was always a trade-off between the efficacy and the comfort and convenience for the child. You know, if efficacy was slightly better, then it had a plunge on the comfort. If the comfort was very good, then it was not as effective as controlling myopia progression. So there was always, it was like a seesaw principle, and hence all the myopia solutions which were there in the past never ever reached to the practices. So now we have a solution. I would say there are a lot of solutions available today for myopia control options. And one of the latest technology which is very, very seamless, which is a robust and a revolutionary technology for myopia progression, controlling myopia progression, is what we have today called as HALT technology. Now, what is HALT technology? HALT is nothing but highly aspherical lensless target technology. Now, this is basically a technology which actually creates a volume of non-focus light in front of the retina. Now, when you have heard a lot of solutions about myopia control, all these solutions would talk about a flat signal in front of the retina. Now, we know that that retina is not flat, it is curved, right? So I would say that this is one technology which actually concentrates on volume of myopic defocus in front of the retina. Okay, so what does this do? Actually, the name itself actually is self-explanatory. It's highly aspherical lensless target technology. So this technology actually comprises of lenslets, which are nothing but micro lenses or nano lenses, which are designed in the form of rings, 11 in number. And these lenslets are actually different in terms of their optical properties between one ring to another. And this difference is what is causing you the volume of defocus or volume of non-focus light in front of the retina. Okay? And it forms as a strong 3D shell in front of the retina. And this robust shell is what is very, very instrumental in actually controlling myopia progression. So when I'm talking about myopia control, it's very important for us to understand this word even more greater. We are not talking just about myopia control, we are talking about myopia management. Myopia management is even bigger than myopia control. You need to understand that it's not like we used to have ad in the earlier days, Honda ad, wherein we say fill it, fit it, and forget it. I don't think myopia control should be done in that way. It should always be follow it, and that is where the myopia management really comes into play. So moving across, I know we have various myopia solutions spread across market. What is very relevant as eye care practitioners is evidence-based approach. We need to see how robust these lenses are, how efficacious these lenses are in terms of controlling myopia progression. And that is where we look at some of the studies which are being implemented. And one of the important studies which were implemented for hot lenses was MyCal lenses, basically talking about myopia control spectacle lenses with aspherical lens lids. Now this was actually a randomized double-blind control study which was done along with single vision wearers. And this study just started off as a study to find out how hot lenses was really efficacious in terms of controlling myopia progression. However, you find that these studies prolonged to 5 years. Now, why did we do that? It's very important to understand whether these lenses sustain the efficacy for a longer period of time. So just on a nutshell, you will find that the myopia progression today, how do we actually monitor myopia progression in two main factors, criterias. One is on spherical equivalent refraction, and the other one is axial elongation. So here we have a study monitored in both these criterias, and you find that at the end of 4 years, you find that in terms of spherical equivalent, the hot lenses were able to control a progression of around 1.34 diopters, okay? And in terms of axial elongation, to an extent of 0.62 mm. Now, is this enough? Of course it is, because we find that we believe that even 1 diopter, if we are able to control, we can actually reduce the risk rate of ocular pathologies. So I will not dwell into it further, but there is a study which very clearly talks about controlling myopia progression even to an extent of 1 diopter. So when you're talking about 1 diopter, here you have a lens which can control even more than that. Is that all? No. At the end of 5 years, you find that the myopia progression control was as high as 1.75 diopters in spherical equivalent, and in terms of the axial elongation is about 0.72 mm. So what does this mean? It means that, one, the efficacy is long lasting. It is spread, it is still pertinent to the kids' myopia control even at the end of 5 years. Point number 2, it was also effective in older children. Because please understand, as practitioners, you don't find kids coming into your practice exactly at 6 years or 4 years into your practice. You would actually see kids coming at a later stage also, maybe about 8 or 10 in your practice. And you are in a dilemma whether you should work. So these studies would actually highlight very clearly that, yes, these lenses would really be efficient even in the older age group. So these 5-year studies actually prove to showcase that, one, the lenses are very effective in controlling myopia progression. Point number 2, it also is efficacious in terms of older children. Now we move on to the next level of category. I know we stress a lot on kids and presbyopes. Somewhere in middle, I think we believe that we don't have any choices, or we don't have anything to talk to the adults or the teenagers, okay? That is not the story. You do have something to talk to them also. I know today all the teenagers and the adults who enter your practice, pre-presbyopes, what do? You dispense them with single vision lenses, right? Now we have something more to talk to them. And before I talk about the technology, let us understand what is the background for these technologies. Very simple. These technologies have evolved basically because we believe that we are always glued to a lot of digital devices, right? When you're talking about digital devices, you find that, according to the Vision Care Council report, we find that we are actually glued to all these digital devices to an extent of 7 hours cumulatively per day, okay? And it is equivalent, or rather 1/3 of the sleep time, which we actually use in a day, okay? So talking about these lifestyle changes which happens of late, I would say it has gone drastically post-COVID. what is exactly happening? What is the main reason why we need something more than the single vision lenses which we have today? Very simple. We believe that when you use digital gadgets, the digital gadgets are held at different distances. It depends upon the screen size. The smaller the screen size, closer is the placement of these devices near your eyes, right? So 40 centimeters would be for the books. That is called as a LDDV, least distance of distinct vision. And then you actually place it as close as 33 millimeters. So this is actually a very, very close distance. And at that point, there's a lot of magnification and there's going to be a lot of strain on the eyes. Okay, so even though you give your customers the best corrected lenses, the accurate power, still, they are going to have a problem because of their lifestyle, So you need to address those issues along with giving them the best correction. And that is where you have these technologies which will play a very important role in your practice. So here, how are we actually going to pitch these solutions to your customers? Very simple. When you're talking about standard single vision lenses, what do? We take the distance PD and we fit these lenses, okay? And that is what we need, okay, for single vision lenses. And accordingly, these lenses are being processed. So when you're actually having a distance PD and you're having a distance reference circle in your lenses, it is, I would say these are actually enhanced for distance vision, okay? Because you don't need particularly any challenge, you don't have a challenge for near vision, right? But you need to know how lenses are being designed, when you have a lens, which is covering the entire frame, but technically you don't use the entire lenses when you view on any object, right? There are certain areas where your eyes will not even move through. So when you're designing a lens, a lot of aberrations are pushed towards the sides or towards the lower bottom of the lenses because you normally don't use those space. That is one of the main ways in which lenses are being designed. So in the current lifestyle, you need to use the lower portion of your spectacle lenses even if you're not a presbyope, okay? So these lenses would act as a revolutionary advanced single vision lenses which would also have a reference point for not only for distance but also have a reference point for near so that the aberrations are not moving in the way of the customer's vision when they use these gadgets. And these are actually one of the important things because when you look at people actually using the single vision lenses, what do they actually complain? They complain that, they are not able to continue their work for a longer time, they have postural problems, neck pain, and they have to break their work time into parts because they're not able to continue for a longer time because these lifestyle issues are posing a problem even though they have a 6x6 corrected vision. So that is where these lenses, what I talked to you about in few minutes back, these lenses were designed using a basic principle called as ergoroma. What is ergoroma? It's a new technology which actually talks about the way in which the person actually works with these or uses these digital devices, okay? So we know that digital devices are used at different distances and you map these digital device usage at different postures, okay? Lying down, in supine position, standing, and so on. Because with every gazes, with every, I would say, the way in which you actually use these gadgets, there's going to be different posture and different way, neck posture and head posture. And when your neck posture and head posture changes, then you will be using a specific area of the lenses when you view these or rather use these gadgets. So you need to understand this better to ensure that when you design a lens, an advanced single vision lens for these customers, you are ensuring that their gazes are not coinciding with the optical aberrations. So that is where your advanced single vision play a very, very important role, okay? So what are these two studies? One was actually a literature review and the other one was a study which I already had highlighted about wherein you had subjects using these digital devices and basically in 3 different postures, supine posture, in standing and of course in terms of and of course sitting postures. And that is where you have a very interesting technology which I'll just play the video for the want of time. Can you please increase the volume? volume, please. Okay, these are standard single vision lenses. These are basically what I told you earlier. It is basically been crafted only for distance vision, where the distance vision is which is more highlighted, because that's exactly what any pre-presbyo would need. Now, what I'm going to talk about is basically a dual optim technology, wherein you are trying to ensure that the optical purity is maintained not only for distance but also for near, especially when people use these gadgets, because you need to understand that these lenses are not designed only for 40 centimeters. You need to design lenses lesser than that, maybe as close as 33 centimeters. So this is where these lenses would play a very important role. And these lenses are called as advanced single vision lenses. So I'm going to the third category of presbyopia. So what is so new for this category? Again, the same thing of fast, pushy lifestyle holds good even for the presbyopic category, because we believe that life begins at 40, okay? So you are at the pinnacle of your career, you are at the pinnacle of your life, and you believe that you need to have a seamless, fluid vision. You don't want to be restricted by your progressive lenses you wear, okay? So before you go on to this technology, I'm just going to flash some numbers here, okay? What do you see there? You see 100,000. What is this exactly? Well, this is the number of eye movements you would make from the time you get up till the time you actually go to sleep, okay? Please understand, this is the high level of eye movements you would all be taking when you are actually performing different tasks, doing different, even for hobbies or any recreation activities. So you are actually constantly, your eyes are constantly moving, and please understand both your eyes have to move in synchrony for you to have a comfortable vision. Now, let us move further to the right side of the slide, okay? What do you see here? You see the eye movements. When I talked about 100,000, I just said it is a magnitude of movement. But what you see in the picture is basically the way in which your eye moves, okay? It is patternless, it is irregular, it is fluid, it is not planned, okay? Now, move to the extreme left picture. What you see here is actually a standard progressive lens. Imagine, okay, you have, and how does standard progressive lens, how are they designed? They are designed in a more or less a linear fashion. You say that power progresses from top to bottom and all those things, right? So imagine you are going to design a lens, okay, where you have highly volatile, unplanned, irregular eye movements, and you are going to be given a progressive lens which is got structured more linearly, okay? And that is exactly where the challenge lies, okay? You may be able to give the best technologies, but because of the fast life we have, the eye movements are very, very sporadic, very, very unplanned and irregular. And that is where the beauty of this technology is going to go ahead, okay? And apart from the movements, there is another important challenge is basically that we are all multitasking. You know, when we talk about multitasking, maybe 10 years back or 5 years back, we were told that if you're multitasking, you're a genius, okay? But today, multitasking is the new normal. Everyone, I would say, even sitting here, maybe once when you're listening to my presentation, I could see some people even looking at their mobiles, okay? So you're multitasking, right? So you really want to be in touch with the news, be well connected with your friends, relatives, and at the same time listen to these lectures, right? No problem in it. But please understand, when you're talking about a presbyope, you need to ensure that this is seamless, okay? It is not having any interruption, okay? So that is where these technologies would play a very important role. So what are we going to do next? That is where the behavioral artificial intelligence plays a very, very important role, and we have a lens which is the first eye responsive lens which is being designed by artificial intelligence, okay? So let me just take you across how does this artificial intelligence actually play an important role. So before I go to that, what is the objective? Very simple. I showed you a very clean slide wherein you had irregular movements, and then I showed you how the standard progressive lenses are, and the best and I think the answer is quite obvious. So what is the objective of designing such a lens is basically to respect the natural behavior of the eye, which is irregular, patternless, and unplanned, right? So you need a progressive lens which can actually complement these types of movements, okay? That's a very simple objective. So to do that, what is the visual requirement you need? Very simple. The clarity, the sharpness is again goes, it is undebatable. Apart from that, you also need to understand that when you're moving from one end to another end, okay, you need to ensure that it is seamless, it's fluid, you know. You don't have to be restricted by blurredness, you know. Suppose I'm moving from one to another one, I don't think I will have time to adapt to the next point if it is blurred, right? So imagine you're doing a task, and that is where the beauty of these lenses are being designed, okay? And to do that, what do you need? You need to ensure that both eyes move in parallel, ensure that binocular vision is being maintained, and ensure that the lens positioning of the zones are also apt in the lenses, because both eyes have to look at the similar areas on these lenses. So what do you exactly need? Again, I'm telling you, I'm sure most of these are repetitive in any progressive lens, but the main thing here is the eye movement. So where we stand here is basically, we talk about the visual behavior. The more we know about the wearer, we can better design the lenses. So just coming across to the AI technology, how is AI technology used here? The AI technology is used for data processing and also for prediction of the visual behavior and bringing about a unique visual profile for every customer. So how does it happen? The data, of course, if I'm going to talk about maybe Varilux, Varilux is in this industry for more than 60 plus years. There is a lot of customers who are successfully wearing progressive lenses. So we have data of those lenses, okay? Their powers and the personalizations and so on, okay? So these data are being analyzed, they are fed into it, and what we do is we have a avatar, a human model, a 3D model which actually does these tasks, okay? And then you understand the visual behavior, you have a predictive modeling, and that throws out a very unique profile for individual customer. So what does it mean? It looks Greek and Latin, very simple. Every customer has a very unique profile because it understands its prescription, it understands its gaze modeling, it understands its accommodative pattern, and you have a unique prescription which throws out. So what is going to be the ultimate? Okay, very simple. Very simple. As I told you, there's going to be minimum disparities of power and astigmatic error between the lenses. So when there is going to be minimum disparities, you are going to have a natural and effortless vision. And just the last slide, I'm sorry, just the last slide. So coming across what is going to be the key takeaway from these technologies, you are going to have your volume of vision being enhanced, okay? So what do you mean volume of vision? Very simple, it's an area where you are able to detect objects, moving objects in your area of zone, okay? And that is very, very important, especially for a presbyope. So your volume of vision is going to be enhanced to an extent of 49% vis-a-vis what you have in the earlier generation of lenses. So just to summarize, what do these technologies actually mean to you? Very simple. When you actually start dispensing these lenses, I would say that every day is a challenge. You will have something more interesting to come and face every day, okay? It is going to be more sophisticated, and it's going to be quite interesting. So gone are those days where you will just pick up a frame and a lens with a prescription and fit it. You have a lot of things to understand and translate to your customers, okay? And that is where our role as optometrists, as eye care practitioners play a very pinnacle point here, okay? So just to summarize, and the key takeaway is, future is not something what we enter into, it is something which we create, okay? And if we create it more confidently, then I would say that we are stepping into the future with a lot of confidence and lot of birth. Thank you.
Thank you very much to you, Mrs. Anantalakshmi. We'd like to invite you to please remain on stage. We do have a token of appreciation coming your way. I'd now like to invite the chairperson of SLOA, Senior Optometrist Shyama Varjani, and the chairman of the 17th Annual Scientific Session, Optometrist Chaminda Ekanayaka, to join us up as we now present this token to our resource person, the head of education at SLOR Luxottica, Mrs. N. Anantalakshmi. Thank you for telling us about the new advancements in eye care technology. To present it, may I invite Senior Optometrist Hiran Pereira. We'd like to invite you as well. So here we have Senior Optometrist Hiran Pereira on stage as well. Let's put our hands together one more time, ladies and gentlemen, for Mrs. N. Anantalakshmi. Thank you so much for being here with us. With that, ladies and gentlemen, we're now moving into our next presentation. And to do the honors of this next presentation, we have optometrist Buddhika Silva, who will be talking to us about the influence of the artificial tears on keratometry measurements by IOL master K values changes in cataract patients. So let's put our hands together for the next presenter. Put your hands together for optometrist Buddhika Silva.
Would all the speakers please stick to the time because we are running way behind. Mr. Buddhika, please stick to time.
Good evening, everyone. I am MG Buddhika Silva. Today, my topic is influence of the artificial tears on keratometry measurement by IOL master, keratometry values change in the cataract patient. Let's move to the introduction here. The corneal keratometry values important component of the refractive IOL surgery. Accurate keratometry essential for the achieving optimal outcome, especially in the cataract surgeries. The biometric calculations including the keratometry are a key part of the cataract surgery. When the patient have a very low tear film on the cornea, it's become challenging to determine the accurate keratometry values which can compromise surgical result. After IOL implantation, achieving e-metric refraction depends on the accurate keratometry. Incorrect keratometry values can change, spherical change after the post-op. Artificial tear aid in maintain the corneal viscosity. You know, one diopter change in the keratometry can lead to one diopter post-operative error. Let's introduction about the tear film. The tear film is a thin layer fluid that covers the surface of the eyes. It plays a vital role in the maintenance corneal health and ensuring clear visions. There are three components of the tears. The first is the lipid layer. This is the outermost layer, helping to prevent evaporations. The second is aqueous water layer, the middle layer, responsible for the nutrition of the eyes and maintain the moisturize. Then third is mucin layer. It's innermost layer that produced by the goblet cell, ensuring that their film adheres to the eye surface. This is I use the instrument for my research. This is instrument I use. IOL master, you know the project it light pattern onto the cornea. This measures the refraction and determine the corneal curvature. The corneal curvature is typically expressed in the diopters unit, measure the refractive power of the eyes. The keratometry can detect the astigmatism by identify the variance in curvature between different meridians of the cornea. The IOL Master 500 is widely used in the ophthalmology and accurate measurement during the eye surgeries. The pedicle cataract surgeries in intraocular lens IOL. The function has set the curvature of the cornea. The aiding determine the refractive power need for the IOLs. The device measures the thickness of the natural lens, axial lens of the eyes. The other additional measurement including the keratometry, which can important factor selecting the appropriate IOL to patients. The keratometry readings, you know, the importance of the keratometry readings for the IOLs. The keratometer readings provide the measurement of the corneal curvature, which can crucially determine the refractive power. They identify the steep and flattened meridian on the corneal, help assume the degree of the axis of the corneal astigmatism. Besides, keratometry reading aids selecting the IOLs, and that either compensate of the correct of the patient astigmatism, ensuring the optimal visual outcomes. These are my objectives. They evaluate the effect artificial tears, the various viscosities of the corneal keratometry readings before the cataract surgeries. The main aim is the study to ensure the accurate keratometry reading without any artifacts, the leading to successful the cataract surgery. The achievement post-operative emmetropic refraction ensure the patient satisfactions. I conducted this research at the Department of Optometry, Lanka Hospital, and 3-month duration. 80 patients is considered both female patients. The study divided into 2 subgroups, 40 and other group is 40. The patient were between 40 and 80 olds. The study designed not for the financial purpose, but only present academic fact. Including the patient is normal eye, those who are dry eye syndrome, this is my method, including the patient with normal eyes, those who are dry eye syndrome, diagnosed based on the tear break-off time less than 10 seconds, and the patient with the corneal pathology were excluded from this study. The eye diagnosis with the further confirmed through the Sermer's test. I used the optive UD drop to my study. The 2 baseline keratometry readings were taken before and after installation of the eye drops. The keratometry reading were repeated intervals, 3 seconds of 2 minutes, after the 5 minutes after application of the eye drops. After the keratometry measurement were taken, all measurement in the IOL master and confirmed by the top cone keratometry. This is my exclusion criteria. The age between 40 to 8 groups, and poor corneal tear patient and patient with the normal eyes. And I used the optic UD for my research. This is the exclusion criteria. The patient with the other corneal pathologies, such as lid retraction and corneal opacities, history of the corneal opacity like keratoconus, keratoglobus, and pellucidum artery degeneration, the corneal ectasias. The patient undergoing treatment with severe dry eyes, taking medicine to know visual functions. Yeah, this is my case. Yeah, there are a lot of cases here. You can see the 7 patient male left phaco. You can see the free tears, that mean before the taking artificial tears. You can K1 is 4177, this K2 is 4396. And after post tears, then you can see the 4288. And after K2 is 44 and 606. You can see the difference of the K1, K2. The K1, K2 is difference of K1 is -1 diopter change, and K2 0, 11 diopter change. This is a change of the diopter after the post-op. You can see this confirmed by the keratometry values 42 and 75, and you can see the 44 K2. This is a pre years average of the both K1, K2s, and this is a post-year average for K1, K2. You can see this next cylinder diopter difference in between the K1, K2 before the application the tears. The -2 diopter you can get the without tears, and after you can see the difference of the -1 after installation of the 3 minutes after the eye drops. This is same like that. You can see the highlighted row. You can see that change is a -2 cylinder diopter before the after application tears, and you can see the next -1 diopter change after installation. This is a very big difference in the -1 difference after post-op. You can see here. This is the same case and same page. There are a lot of patient I covered this study. This is the actual result of the IOL change between the K values. And this is a post TS and pre-TS cylinder difference. You can see the first here. And here this result of post-years and previous cylinder difference. This is my comparative analysis. The selecting the will cover the comparative analysis to test group focusing on change in the keratometry measurement and study significant dose change after the application eye drops. Those two groups tested show the significant change corneal curvature measurement, and with the diopter difference moving from less than 0.50 diopter as much as 2 diopter, including the marked effect of the after treatment. We use the sample test to determine the mean difference in between the keratometry measurement before and after 30 seconds after the eye drops were applied. The significant difference can detect. This is an approach to help confirm whether the eye drops had measurable effect. Those are, you can see the change of the IOL after the cylinder power changes. These are diopter changes cylinders in the IOL due to the keratometry errors, calculation in the biometry. And you can see the up to change after the using the artificial tears, you can see the down without tears change the cylinders powers. And those who are pre and post keratometry changes, and you can see the difference here, big difference some patients. And those are the keratometry values of the patient keratometry change in the one graft. This is the result. Now we will explore our secondary objects which focus determine the application viscosity of the eye drops, impact keratometry values different in the normal line and dry eyes. In summary, then in explore the analyze show the difference in keratometry values between normal line dry eyes, particularly after application eye drops. We will also observe change in the astigmatism, which is important when considering IOL implantation. The manual keratometry, this is my conclusion. The manual keratometry readings were found to be highly accurate to correct, and this is a dispersity of artificial tears were installed after the performing of the IOL master measurement. This adjustment result is the keratometry reading consistent with those manual keratometry when calculating the IOL power. We will typically rely on the IOL master, which shows the mismatch in between the keratometry. And the lubrication of higher viscosity had a more pronounceable effect on the keratometry readings, demonstrating the influence of the tear film on accurate measurement eye drops. Particularly those with higher viscosity were identified as strong influence factor of the keratometry readings, with the most notable change occurring with the 5 minutes after installation. This is my reference. This take-home message is respect to the keratometry, regain the accuracy of IOL master biometry. Special thanks to Sri Lanka Optometric Association, Dr. Samantanand Vasanke Eye Hospital, Optometrist Vidya Jaratna, Optometrist Chanaka Bandar Visundra, Optometrist Mangala Samarakon with Usara, Optometrist, Senior Optometrist C. Kubadu, and Vasanke Eye Hospital. Thank you very much. Any questions?
So you had 80 patients that you took data from. You have said 80 patients with 40 patients in each subgroup.
That's been one group for pre-installation eye drops and other groups post-installation eye drops.
Right. So these K values significantly improve, was significantly in the IOL master. You saw a significant improvement on.
Yeah, we can get the improvement with the drops. Sometimes patient has a low content of tear volume.
Yes.
We can't get the correct calculation of the IOL.
Yes. Yeah. So with the drops, the IOL master showed
the best result and best accurate result after the post-op.
Almost as close to keratometry.
Yes.
Manual keratometry readings. Okay. Right. So what are your suggestions based on your study?
As a suggestion is when you are doing that biometries, and we don't think about the patient's cornea viscosity and cornea tear film level.
Corneal pathologies have been excluded, no?
Excluded, yeah, that is excluded. But I mean that the corneal tear volume is not good. The post-op pre-fraction and post-operative IOL management is changing.
Yes. Right. Okay. Good presentation. Thank you. Thank you.
Let's put our hands together, ladies and gentlemen, for optometrist Buddhika Silva. Thank you very much for that insightful presentation. Up next, it's now our pleasure to introduce to you yet another special guest from India. She is Professional Service Manager, South India for Bosch & Lomb India Private Limited. She's also, of course, very well known to the optometric community right here in Sri Lanka. Over the years, she's made a significant impact with her contributions to the field of optometry, and we have the privilege now of learning from her expertise. So, with that being said, let's welcome Mrs. Jayashri Sekar.
So very good evening to one and all. So my topic of presentation is about proactive recommendation to reposition your contact lens into your practice. So now till now we have seen many presentations, right? So takeaway message, end of the day what you have to do? End of the day we want the business to be increased. So that is where the focus will be on. So for that, as a practitioner, if you want to recommend something on the contact lenses, so what is meant by proactive recommendation? Anyone have any idea what is my proactive? The word proactive. Basically, the proactive means the person who willingly takes some initiatives, okay? So if you want to do something in your life, be proactive, do by ourselves, right? We motivate ourselves, we have to do something. The same way, if you want to improve your overall contact lens business, the proactive recommendation is very much important. How it is important, we'll be seeing with the upcoming slides. If you just see what are the reasons for the low penetration, okay? The lack of awareness about the consumers and increases chair time of ECP. Few may not be sure what is the chair time. The time which you spend with your patient or your customer, that is called as the chair time. ECP is eye care practitioner, okay? Lack of proactive recommendation from the ECPs. So these are the three main reasons for low reasons of the contact lens penetration. If you just, they done a study, there's something called as the reactive or proactive contact lens fitting. So what makes the difference? So they've taken a group of almost 80 people, they divided them into two different groups. They put it in the reactive and the proactive people. In that, with the reactive means the people who have already had awareness about contact lenses. Proactive is where the practitioner themselves are given a choice for the patient. Why can't you go for a contact lenses? So they segregated between the two groups. So with that, they given a trial for the proactive. They almost 46 people, they said, let me try what is contact lenses. People who had already had awareness, only 9% people have tried what is that. In that, the conversion rate is, everyone becomes almost like 38% people, they said, I want to buy lenses. And 6 people, they say, just I want to give the lenses trials. So almost 57 subjects or people trying contact lens will afford positively. If you just take it, there are two different way of approaches. One is called as the conventional, one is called as the ease approach. Ease approach is nothing but, for example, when somebody comes to your opticals to buy some spectacle frame, suppose its refractive power is around -5 or -8. Can he choose a frame by himself or herself? They require someone to help them to choose a frame, right? In that cases, if you have a trial contact lens with you, you can just opt a lens for them where they can try the contact lens on themselves and which helps for the routine practice. So contact lens can be introduced as a low-key manner as an aid to a spectacle selection. Instead of telling there is a contact lens option, why can't you give a try? Instead of saying like that, to choose your frame, why can't you give a try with our contact lenses? So by choosing the frame, they can go for a better option. So that also becomes like a ease approach. If you just take it the purchasing pattern in terms of the period, okay? So once you do it as proactively, within a 7 days of time, almost 32% of people who have done a trial proactively, where you given the trial contact lenses, they came back to your clinic and they bought it within a 7 days of time. Within 8 to 14 days of time, almost 41% people who came back, where they used a trial for a week or so, where they were comfortable, they start to come back. Within 15 to 30 days of time, 14% people came and bought the lenses. Within 1 to 3 months of time, 13% of people came and bought the lenses. If you just take in the purchasing method, pattern in the terms of modality. See, modality means, as you know, we have different type of lenses. We do have yearly, we have monthly, we have bi-weekly and dailies also. When you do as a proactive recommendation, when the patient comes to your clinic, with the conversion rate, in that rate, almost 46% of people who bought monthly replacement as an option. Then they went with the daily contact lenses was 40% and bi-weekly was 14%. If you just say 80% of the subjects were agreed, vision is much comfortable with the contact lenses, and proactive recommendation can only lead to create a contact lens awareness. The process of wearing contact lenses quickly than they expected. 72 subjects are interested to wear the contact lenses. So they also found one thing on the study, there is a communication gap between the practitioner and the patient. So when the patient will start to ask something, how the practitioner reacts, that also matters a lot. Despite of all these changes, 85% of the contact lens wearer actually getting refit with the same type of lenses. For an example, the customer was using some hydrogel contact lenses, and if he comes to your clinic and he complains of the contact lens induced dry eye, or if he says he can't use the lenses for a longer period of time, or if he says end of the day I feel my lenses are getting stuck to my eyes, I feel I can't able to remove it. Still the practitioner was prescribing the same hydrogel lenses to the patient. So that's what it meant. Almost 85% current contact lens are refitted with the same type of lenses. Anyone have idea like what is the normal tear secretion per day? Normal tear secretion per day. Ma'am was, Antalakshmi was talking about, right, how much eye movements we do, how much time we spend on digital devices. Anyone have idea what is the normal tear production per day? We talk about dry eye. How we come to our conclusion that patient is having a dry eye? We do many tests to confirm that, right? So basically when we just talk about the tear film and the normal tear secretion, if you just take it, it will be around 1 to 1.5 ml for the day. Okay, so patient is having a dry eye, it will be less than that. So we have to see whether the dry eye is because of contact lens induced dry eye, or otherwise the patient himself is actually having a dry eye. So we have to do other tests to confirm. According to that, we have to prescribe the lenses. If the patient is having a contact lens induced dry eye, as a practitioner, we have to make sure what type of lenses they are given, whether it's a high water content or a low water content contact lenses, or it's a hydrogel contact lens, or it's a silicone hydrogel lenses. Suppose a patient is having a contact lens induced dry eye, we recommend them the low water content contact lenses, not the high water content lenses. So as a practitioner, we should know what type of contact lens is advisable for that particular patient. So choosing a patient with the right choice of contact lens is very much important. What the consumers expect as a practitioner. When the customer comes to our clinic, they expect us, they want to be heard. They doesn't want to be listened. Okay? When they come to your clinic, they want whatever complaints they're giving about their current lenses. They want, as a practitioner, they have to be heard. But what we do as a practitioner, we know many things than them. We start to talk more. We never ask the patient to talk at all. Where there is a gap between the practitioner and the patient. So basically what they expect, and the study also shows that is, as a priority, the customers feels like, first thing what they expect is, they want to be heard instead of they want to listen to you. Okay, once you start to heard what they are telling about their complaints, then as a practitioner, if you start to give them the proper advice, then they will listen to you. Okay, first thing as a practitioner, we should heard what the patient is telling, then we have to start to give them the correct option of the lenses instead of just talking what we want to talk. If you just take the options also, so first they expect like the personalized expectations, what they expect. Okay, so that's what is very much important. So opportunity, when you start to hear what they want to tell, with that whenever the customer talks about the lenses, or what are the complaints they are facing it. So with that we'll come to know, okay, what will be the other best option we can offer for the particular customer. So there is always an opportunity to invest in the chat time of the patient. As a practitioner, we should be very much open and to hear what the customer is telling, and surely it will be a great opportunity for us. And if we just talk about the revenue, okay, so there was a study done, and the study shows like almost an average contact lens wearer spends almost 2.4 times more than the spectacle wearer. How is spending more money with us? Because all this contact lens wearer, for surely they have to buy a pair of spectacle as well. Contact lens customers has to buy your solution. When they start to wear a contact lenses, they feel to wear a sunglasses, so they have to buy with you that. So for example, if they start to dispense contact lenses, whenever they want to buy the contact lens solution, they have to come to your clinic. In that time, if you run some offer or something, again they start to buy something about the solution, or they buy some sunglasses. So the study shows almost 2.4 times the contact lens wearer spends than your spectacle wearer. How we can alleviate the customer's cost concerns? Generally, customer comes to you and they ask, it is very expensive. That's the mindset what they have on the cost. So once they talk about the cost, as a practitioner, we have to understand the patient's journey by like, what is the right option for them. We often will, I'm sorry. We forget to ask like, if you want to change one thing, what would be? So if the patient may say like, I'm not comfortable, it is not so comfortable, I'm having a headache or dryness, they give you many number of reasons. As a practitioner, we should understand the patient journey and waiving the cost by optimal lens practice. Some patient you would have seen, they will be buying a monthly lenses where they will be using for 45 days to 2 months also. When they start to use like that, they may end up with maybe some eye infection where they have to do several visits to the hospitals, or they start to use eye drops, not to mention the potential disruption of the routine or the quality of life. Strategy to reduce the cost is therefore critical to mindful how the price of these products and make sure we are doing everything possible to help our patients afford their lenses by helping maximize the rebate use. So when the customer comes to a clinic, instead of telling its cost you, for example, say some 5,000 or 10,000, you can divide the cost per day and you can show them. That becomes easy for them to, instead of saying it costs you around 10,000 rupees for 3 months or say some 6 months, instead of telling us a big number, if we just divide that into cost into a day basis, that becomes easy for them to understand. That when they go out to have a coffee or a tea, how much money they spend per day? Or when they go travel, they have many things, right? If we divide the cost on the day basis, it becomes easy for them to understand the cost wise. The bottom line is, so whenever we embrace a new technology, products for a higher margin, patient benefits, so whenever any company, as ma'am said, so we always have to be updated with the technologies. With the many companies are dispensing lenses, so we should be aware about what are the technologies are there, and we have to see which lenses will be benefited for your patients. You need as a multifactorial approach. So contact lens is a lens, revenue demands a multifactorial approach, blending technology and strategic partnership and patient-centric service. So focus on key contact lens manufacturers. So once you have a good rapport with your manufacturing companies, like if you start to get the trials from them, so when a customer comes to your clinic, if you have a trial at your place, it becomes easy for you to dispense the lenses, so where you can choose your portfolio from daily or a monthly. Now we are using a multifocal as an option also, right? So currently we have a multifocal contact lenses in Sri Lanka, and we do have it in a hydrogel and silicon hydrogel as well. So our lenses center near design. So multifocal is a contact lens where you can give for your presbyopic patient, and our multifocal contact lens basically we call as a center near design. Okay, why we call them a center near design is, once we look down, as we know it, our eyes will converge, okay, and the pupil become constrict. So center of the contact lens have a center near design. So be very clear for your near vision. When the patient looks straight, the eyes actually diverge and the pupil become dilate, where they can start to see with the distance vision. And our lens is a simultaneous aspheric lens design. So we do have an option of multifocal contact lenses in Bausch & Lomb, so where you can prescribe. Currently it is available only with a spherical power. So if the patient is having a cylindrical power up to 1, you can make it as a spherical equivalent and we can start to prescribe it. Above 1 cylinder, the patient is very much interested for contact lenses. Yes, you can prescribe it. There's something called as a modified monovision, where one eye you can fit it with a multifocal contact lenses, where other eye you can fit it with a single vision or with a spherical lens or with a toric contact lenses. That is called as the modified monovision. So these are the two options are there on the multifocals, because if you multifocal patient, not everyone can afford it. We can go as a monovision also. But when compared to monovision, the success rate with a modified monovision is higher. So you can just give a try. So one eye with a single vision contact lenses and other eye you can try with the multifocal contact lenses. So these are the options are available, multifocal as an option. Because the market is moving towards multifocal and the growth is also there on that particular category. And if you know, it is easy to dispense the lenses above age of 40 instead of giving lenses for youngsters. Because youngsters, they want to have a trendy frame, they want to do like that. Above age of 40, they doesn't want the age to be known to others. And so they suddenly they can't go with reading glasses and people will come to know their age. So they can't, so they won't want to feel to wear a glasses. If that is the right category, you can impact for the multifocal patients. So above age of 40 is the right option where you can start to dispense multifocal contact lens as an option. Anyone loves to tell their age to everyone? Someone asks your age, will you tell to them? Antalakshmi ma'am will tell. I'm not telling about ma'am. Will anyone will tell their age? Especially above age of 40. Will they tell the age? It's very difficult to tell, right? So always the people says, no, 40 is new 25. Is that true or not? 40 is new 25. We can say 40, right? Okay, so age is just a number. So we can, so in that kind of a patient, nobody, see in this crowd, nobody wants to tell their age, right? I'll tell proudly, I'm 40. Okay, I just become 40, so I'm yet to use my multifocals, but I'm proudly say I'm 40, okay? So multifocal as an option is ready for me as well. I'm yet to start it. So once I start to use, I can give you better comments about the multifocal contact lenses. So the takeaway message is, the contact lens can be owned almost everyone who enters to your clinic. Don't wait for them to ask. As a practitioner, we should be more proactive and take the lead, taking actions to make changes yourself rather than reacting to things that happens. Everyone, thank you so much.
Thank you very much. And of course, we'd like you to remain on stage, Mrs. Jayashree, because we have a token of appreciation coming your way. I'd now like to invite Chairperson of SLOA, Senior Optometrist Shyama Varjani, Chairman of the 17th Annual Scientific Session, Optometrist Chaminda Ekanaika. We'd also like to invite Senior Optometrist Kumari Jayasingha to please join us up right now as we present a token of appreciation to our guest speaker from India, Professional Service Manager, South India for Bausch & Lomb, India Private Limited. This is Mrs. Jayashree Sekar, and we appreciate her time as well as her expertise with us here at our annual scientific sessions. So as the token is being presented, ladies and gentlemen, can we please put our hands together as we say thank you to Mrs. Jayashree Sekar. Thank you very much to you, madam, and with that we say thank you to our presentation party as well. We have another presentation to go, ladies and gentlemen, and I do believe that this will be the final presentation of our sessions. To talk to us now about the importance of considering the notch of glaucoma, we have optometrist Methma Malvatta. Let's put our hands together as she comes up on stage, the final presentation.
college optometrists. Have you ever seen a notch? Have you ever considered the importance of the notch? This is about it. Let's see what I have to tell you about the notch. Imagine losing your sight due to a condition that often goes undetected. Glaucoma is a silent thief of vision, and early detection is crucial to prevent irreversible damage. Today I am going to highlight the importance of the notch. The purpose of this presentation is to emphasize the importance of considering the presence of a notch in the optic disc as an early indicator of glaucoma, even when the traditional assessment parameters like CD ratio and the Eisen rule are within normal limits. Objectives. Highlight the significance of the notch in early glaucoma detection. Evaluate the effectiveness of notch as an additional diagnostic tool alongside CD ratio and Eisen rule. Identify limitations and potential areas for future research. Advocate the inclusion of notch assessment in routine glaucoma evaluations. 569 clinically confirmed patients from Nuwannaikkaya Ruwanwැල්ල since 2015 were considered in this study. All type of glaucoma patients were taken as a one group. CD ratio was considered from 0.4 to 0.95. IOP of these patients were brought to O already in the normal level by now, by the time I did my study. Usually, we tend to refer patients with more than 0.6 cupping for glaucoma assessment. How come a CD ratio 0.6 or less than that become glaucoma? කොහොමද ඇත්තටම මේ 0.6 හරි ඊට අඩු හරි කපින් එකක් තියෙන කෙනෙක් glaucoma වෙන්නේ? දැන් අපි හිතමු අපි ළඟට එනවා 0.5 කපින් එකක් තියෙන patient කෙනෙක්. Eya already diagnosed as glaucoma patient. So, what is the reason for that diagnosis? It is due to creating a notch with the erosion of the optic nerve rim up to affected range. Here are some optic disc images with notch. Here, the CD ratio is 0.3 to 0.4, breaking the Eisen rule with a superior notch. You can see the sharp end of the cup with clear erosion of the nerve rim in that area. I think it's clear to you, that arrow with the notch. This is called a notch. Because of that notch, retinal nerve fiber layer bundle, there I have marked that, is damaged. It's clearly visible as a dark area there. A notch in the optic disc is a focal loss of neural rim tissue that is a characteristic sign of glaucoma. Here, the CD ratio is 0.55, breaking the Eisen rule with the inferior notch. In this picture, CD ratio is 0.5 and does not break the Eisen rule because of the temporal notch. And a 0.7 CD ratio, which doesn't break the Eisen rule, it's also because of the temporal notch. Method. Let's see. First, we divided 569 patients into two groups according to the CD ratio. Majority was more than 0.6 CD ratio, and that was 398 patients, which is 70% of the total. The rest of 171 had a CD ratio equal or less than 0.6, and they all exhibited a notch. They were 30% out of the total. Remember, I'm here talking about glaucoma patients, already diagnosed as glaucoma patients, confirmed by consultants. So, then we divided this 171 according to the Isant rule. 103 broke the Isant rule, while 68 accepted. Why do they accept the Isant rule, as you think, even being diagnosed as glaucoma? Any answer? Because the notch they have is temporal. So, here in the picture, this 398 are CD ratio more than 0.6. The other 171 are CD ratio equal and less than 0.6. So there is a countable percentage out of the cases who have glaucoma already, even if the CD ratio seems normal, means 0.6 or lower than that. Then that 171 is again divided into 2 according to Isant rule acceptance. As I mentioned earlier, 103 break the Isant rule, while 68 follows the Isant rule. These 68 cases are really important. Their CD ratio and Isant rule are within normal limits. So, these eyes could be missed easily. A temporal notch is the only clue to get them into the bot. According to findings, 12% out of total glaucoma patients indicated CD ratio and Isant rule are within normal limits, but they had a temporal notch in their optic disc. The temporal notch is the only visible way to detect the glaucoma early, before other diagnostic examinations like OCT, optic nerve head, right? This study emphasizes the need for comprehensive optic disc evaluation, including notch assessment, to improve glaucoma detection and prevent vision loss. These are some identified patients and referred their visual field defects. Limitation. Here are the limitations I met during my study. Single center study. I took the patients from one institute, so potentially limited the generalizability of the results. Further research is required to validate these findings in diverse populations. Subjective notch assessment. The assessment of notches is subjective, and inter-observer variability may influence the results. Standardized criteria for notch identification and grading could enhance the reliability of future studies. Further research is warranted to address the limitations and refine the clinical application of this approach, along with OCT ONH reports to present. Here are patient data collection, because we keep the records of glaucoma patients. Dear colleagues, if you give respect to the notch, you will never miss a glaucoma suspect. Maybe you are the first and last person to examine their eyes before blindness. Thank you.
Thank you. It's a very nice presentation.
Thank you, sir.
One comment, you say there is a limitation.
Yeah.
Your limitation is you have taken this particular sample. In fact, it's not a limitation. It is a limitation only if you consider it for different social groups, different various other things. But you are very, what shall I say, very sincere to say that it's a limitation.
Yes,
which
so
is
because in some regions I have seen they don't meet such amount of glaucoma
Correct.
patients.
That, in other words, your research finding can be generalized within your sector.
Yes, sir.
Yeah,
Yes.
that way it's okay. And I think you have done can you tell us in one or two sentences what is the value of this research for us?
Yes.
I know you said that, but
Yes,
I want
sir.
you to
Sure.
make it more clearer.
Yeah. When we see a normal CD ratio and if that optic disc is following the Eisen rule, usually nobody is caring more, sometimes I think, not everyone I think. If we consider about the notch furthermore, we will never miss that patient as a glaucoma suspect. That could be not a glaucoma patient, but we should give our attention to that patient and do further investigations. So, because we do that, we might not miss another glaucoma patient. Maybe you suspect 5 patients and only 2 is found. But that's also something very important, I think.
So I have a few questions. We are trying to wind up. So
Sure,
just
sir.
so this cup to disc ratio among the patients, you have 569 patients that you went through. The cup to disc ratio was normal, like less than 0.6 or less in about 30%,
Yes,
right? So in
0.6
the presence of a notch,
or lower than
lower,
that.
yeah, in 30%,
Yeah.
right? And for the temporal side notch was seen only in 40% of those patients.
Sorry, sir?
Temporal side, the notch was seen only in 40%, no?
Yes, not 40%, actually it's 12% out of total. There I have calculated 171 as 100. In the
Right,
next
right, right.
one.
So
Yeah,
from that only you have derived the percentages
Yes.
afterwards, yeah.
It's totally 12% out of total glaucoma patients.
Right.
I
So the
can-
others were mostly inferior and superior, no?
Yeah,
Right.
yes, sir.
So yeah, it's a very nice study. So you have now all this was done retrospectively. You did it in glaucoma patients, no?
Yes.
What kind of study center was this? The government institution.
Sorry?
The study
No,
center
no.
was.
It's a private clinic, yes.
All right. So you came across quite a number of patients, no?
Since 2015.
Right. So in a
Yes.
10-year period. So have you, just for me to know, have you considered in the future, like if the cup to disc ratio is 0.6 or less, but you have seen a notch, have you referred any of those to eye surgeons for glaucoma assessment?
Yes, almost.
All right. Okay. 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 Thank you very much. Okay. Hope you can expand this more and like have more data within the next few years again.
Thank you so much, sir.
Let's put our hands together for optometrist Metma Malvatta. We'd like to invite her to remain on stage because it's time now to present the certificates. I'd like to invite on stage the chairperson of SLOA, Senior Optometrist Shyama Varjani, chairman of the 17th Annual Scientific Session Optometrist Chaminda Ekanaika. We'd also like to have the presence of mentor optometrist Sandaka Lenagala to please join us up and present this certificate to our presenter, who has been optometrist Metma Malvatta. She spoke to us about the importance of considering the notch of glaucoma. So well done on your presentation. Let's put our hands together, ladies and gentlemen, for optometrist Metma Malvatta. We'd also like to invite on stage optometrist Buddhika Silva. He is the other presenter. We'd like you to come up. We say thank you very much to mentor optometrist Sandaka Lenagala. Thank you, sir. We'd now like to invite senior optometrist Gwen Gurusingha to join us in presenting this certificate. So optometrist Buddhika Silva spoke to us of the influence of artificial tears on keratometry measurements by IOL master K value changes in cataract patients. Let's put our hands together for optometrist Buddhika Silva. And with that, we say thank you very much to everybody who's joined us on stage. We've come to the end of the sessions. We do have something else coming up, but for now, that's all with regards to the presentations that we have for you.
Thank you, Trishma. So ladies and gentlemen, we're going to switch things up a little bit. We're going to hand over the stage to someone that's very popular and well loved in our SLA community. He is known for making learning interactive and a lot of fun. And today he will be running a quiz session that's going to get a lot of people involved. Ladies and gentlemen, please give a warm welcome to Senior Optometrist Chanaka Veerasundara.
So this is going to be the last session for the day. So we have set up two teams for the junior contest. This is the first time that we are going to have that kind of a session in this forum. So let me call upon our team leaders, Sajika and Lalit. Please bring your teams and come forward. So let me call upon Madhuka Atukorala, Malika Agalavatta, Metma Malvatta, Sasini, Gayan Buddhika. Towards my left-hand side. So that's team gold. You can see the table, it's gold. That's why it's named as team gold. And Lalit's team, Samantha, Nuan, Niroshan, Janani, and Lakmini. Please come to the stage. So this will be a good interactive session. So why we designed this kind of a quiz competition is to have a little bit of fun, not to let you down, but for newcomers to engage even in future in this kind of conditions and this kind of competitions. That's Niroshan. Yeah, he's coming. Right, so ladies and gentlemen, give a good round of applause to these two teams. Right, so before we start, I'll tell the ground rules. So each team has 6 members, but at the first round, I am going to give 5 questions. You can select who is going to answer. And if that member, when I'm putting a spotlight, if he answers, you get 10 marks. But if you fail to answer, that question goes to some other member in the same team, but only you get 5 marks, right? Even failing which the entire team failed to answer, it passes to the other team, and they get 5 marks. That's the first round. Is there any questions? No. Right. Second round, how it works, there will be common question for the entire team. One of them can answer. There will be about 3 questions. We're trying to manage the time also. So the same, the other team get 3 questions, anyone can answer, right? Failing which, it's passed to the other team, right? So every correct answer, 10 marks. If he passes to someone else or the other team, it will be 5 marks. So Vidya, please keep a note on that. And the third round will be fastest finger first, right? Fastest finger first. So I'll be putting some slides on the screen. Whoever know, you have to first click the bell, like that. So that team get the chance to answer. Failing which, the other team get the chance. So there will be about 5 questions like that. So, to be fair with them, I have decided about a pool of questions, about 45 questions. And I am not looking at the face and giving questions. I'll be giving some small tokens. According to that only, I'm going to just give the questions, right? Let me give you the tokens small. Huh? All right. So, let's begin the questions. First, I'll start with Team Gold. So, who is going to answer the first question? Take the mic. Right, Sajika. So, what's the number?
Number 2.
Number 2. Right. Number 2. Number 2 question. Can you please put it on the screen? Question number 2. Right. So if you're going to dilate a person to investigate, the back surface of the eye or the posterior segment, so what do you do to speed up the dilation process?
We can dark the room.
Right. Okay.
We can apply more drug. We can use combined drug.
Combination drugs, right? At least 3.
And we can apply more drugs if it is necessary. And we can block here.
Okay.
Block the drain.
To compress the nasal side
Nasal side.
without draining. Right. Okay. So I have decided 5 answers, but at least 3 would be sufficient. So she said to dilate the speed of the process of dilating. So here the answers: turn off light, that means dim the illumination. Use higher concentration of drugs, and you can use combination of drugs. Use topical anesthetics or press up against the lacrimal sac drop to do not to drain it out. So let's give a good round of applause. So you get 10 marks. Right. So the next question is to Team Silver. So who's going to answer first? 34. Right. Lalit, what's the number?
34.
Number 34. Right. So number 34, what is the longest extraocular muscle, and that muscle innervated by which cranial nerve? What's the longest extraocular muscle?
Superior oblique.
Superior oblique is correct. So what's the nerve going to innervate the superior oblique?
Fourth nerve.
Fourth cranial nerve. So give a good round of applause to Team Silver. All right. So please make marks. Right. So I'll move to the Team Gold. Who is going to take the next chance? All right, Sashini, what's the number? Number 6. Number 6. Question number 6. Right. So it's a quite interesting question. So when you doing retinoscopy. In retina, you know, we had to assess 4 things like optic nerve head, the vessels, general background, and the macula. So, when you assess retinal vessels, what are the features that you're going to assess in retinal vessels doing ophthalmoscopy or the fundus examination?
AV ratio,
AV ratio, that's right.
AV nipping,
Okay, if there's any nippings, okay, very good.
whether vessels are shifted,
Okay.
shifted and
If
for
it's
the
the
disc.
glaucomatous retinal vessels are shifted toward nasal side, but any other answer? Any other thing come to your?
hemorrhages,
Okay,
Aneurysm.
the hemorrhages near, that's actually hemorrhages also in the general
neovascularization.
Neovascularization, yeah. So 3 answers are correct. So give a good round of applause to Team Gold. Right. Who's going to take the next question in silver team? Team Silver.
It's number 20.
Question number 20. Right. So, question number 20. So, this is regard to color vision. So, what are the differences between deuteranopia and deuteronormalus trichromatism? Deuteranopia and deuteronormalus trichromatism. What are the?
Yeah, deuteranopia means the green wavelength. The cone is absent. The deuteronormalus means anomaly. That means the green cone cells not functioning well.
Fantastic. Give the round of applause. Deuteranopia means the second cone or a green cone absent or missing, and deuteronormally means some anomaly. Though it's trichromatism, all 3 type of cones are present, but in the second corner, that or the green cone, you have a little bit of an anomaly. Okay. Next question to Team Silver. Sorry, Team Gold.
22.
Number 22. Question number 22. Easy question. So, you know, when we evaluate the eyes, sometimes we may see blood in anterior chamber. So, what's the term we use, blood in anterior chamber?
Definitely hyperemia.
Hypema. Right. Give a good round of applause. Blood in anterior chamber is called hypema. So those are easy questions, so I'll make it process easy. Right. Next question is to
11.
number 11. Now you see, all these people are gone with extensive studies and they are answering very well. So I'm glad. So number 11. So what are the symptoms of acute angle closure glaucoma?
Blurred vision, red eye, nausea, vomiting, eye pain, red eye, halos around lights, loss of vision, hazy cornea.
Right. So he has given many answers. I just highlight few things that teacher. She said it's a painful red eye. That's the first sign. And hazy cornea, yes. And halos around eye. Very good. So there are many other things we can, especially when it comes to looking the halos around right and the hazy cornea and the mid-dilated pupil and a little bit of high intraocular pressure, which are the symptoms of angle closure glaucoma. Right. So how many questions that I have pointed out? 3. Okay. Next chance is yours.
32.
Question number 32. Question number 32. Right. Easy question. It won't take so many time. So what's the diameter of the optic nerve head?
1.5.
1.5 millimeters. Give a good round of applause to Malika. 1.5 millimeters is the optic nerve head, same as the foveal, central fovea, also 1.5. All right, the next question goes to Team Silver.
45.
45. Question number 45. Right. Yes. The question is here. You know, when we, this is visual acuity, we use different kind of charts. But here, what's this term stand for? Logma. What it stands for?
Logarithmic minimum angle of resolution.
Give a good round of applause. Exactly, the logarithmic minimum angle of resolution. It's a more accurate way of assessing the visual acuity. And this is the gold standard. Fifth one, no?
Number 17. Number 17.
17. Question number 17. Question number 17. So what is trichromatism?
All three types of spotter cells are working impressive for the distinct colors, including white.
Exactly. So trichromatism is all three type of cones to see all colors, including white. So all three type of cones are present. Thank you very much, Buddhika. So the final question, I think, is it over? Or? One more. So he's going to take a chance. What's the number? 20? Number 24. Right. Can you put the question on the slides? So which retinal cells are affected in RP first, retinitis pigmentosa?
Rods, first rods, after that eventually cones.
Exactly. The retinitis pigmentosa is a genetical condition which affects the rod cells first, then eventually, slowly, it affects the peripheral vision and comes to the central vision loss. Right. So I think the first round is almost finished. You all answered 5 questions, and Team Gold also answered 5. So give a good round of applause until we move to the second section. Right. So let me quickly flash 3 questions in round 2. Can you all take 3 tokens here? Right. So only I'm going to ask 3 questions from the entire team. Whoever knows the best answer, you can answer, right? So these are not very difficult questions also, because I want to have, because they were, when we asked to participate for this quiz competition, they voluntarily came up, so that confidence that we value, right? So we have to encourage them. So again, before we start the second round, please give a good round of applause to the both teams. Very well. There's no energy much, but you have to everyone you have to clap. Yeah, there. Now there's energy. Okay, so 3 tokens you have taken. So I'll first flash the question to Team Gold. Who is going to take the chance? Not who, but tell me a number. Anyone can answer. Number? Number 5. Number 5 on slides, please. Right. So you know, when we evaluate the posterior segment, mostly by ophthalmoscope, or we use auxiliary lenses like 70DA, 70D, 78D, and 90D lenses. My question for Team Gold. So what are the main differences between, okay, it's compare 70D and 90D handheld lenses when you're doing examine posterior segment.
In 78 diopter lens, the magnification is higher, the image is bigger, the field is narrowed. And we can hold the lens a little bit further away from the eye. In 90D, we can see a larger area more than the 78D, and the image size is a little bit smaller than 78.
Right. That answer is good enough. Right.
Yeah,
Very good.
Small pupils also can be
Right.
examined by.
Very good. So 78Ds, the magnification is little higher, so the visual field is little less. So the 90D is little bit of a low magnification when you compare with 78, but you can see a more wider field. And for assessing small pupils, as she said, 90D is better, and you can hold the 78D little further away. So very good. See, I mean, they are very comprehensive. All right, very good. So the full marks for that team. Full marks. So let's move with team silver. 33. Question number 39. Right. So this is about the duochrome test. So now we are talking optometry. So the duochrome test is based on which phenomenon?
So chromatic aberration.
Chromatic aberrations, exactly. Give a good round of applause. Right. Next. Number 8. Number 8. So you all know when we assess fundus, we use different kind of auxiliary lenses. But here it's a little different. So there's a lens called Herbie lens. So how does it different from the other auxiliary lenses like 90D or 78Ds also we use to assess? So what's the difference between the Herbie lens and the other 98 or 90 or 78D lenses? Who is going to answer?
Lens means it's plano minus 55 lens. It's where we used to keep the image upright. Keep the image upright.
Exactly. The other lenses, 78 or 90D lenses are plus lenses, and the Herbie lens is minus 55, and it keeps the image upright, and it neutralizes the total the eye power, and you can observe the posterior segment correctly. So give a good round of applause to Team Gold. Right. Next question. Number 10. Number 10. What is gonioscopy?
So it is the method of assessing the anterior chamber with 3-mirror gonio lens. Anterior chamber angle.
Right. So gonioscopy is a procedure to assess the anterior chamber angle. Very good. Give a good round of applause. And there are many ways of assessing anterior chamber angle, which is with slit lamp we do with Van Herrick and Smith methods, anterior chamber depth, and the other way is 3-mirror gonioscopy. So the procedure is gonioscopy to assess the anterior chamber angle. Very good. Another good round of applause to that team. Number 27, the final question of the second round. Number 27. So all given correct answers. Right. Question number 27. Pseudopapillitis. Pseudopapillitis is a sign in which refractive condition?
Seen in high hyperopic refractive.
Pseudopapillitis is a condition that we can see in hyperopic conditions. Give a good round of applause. With small eyes with hyperopic, yeah. So that the answer will be sufficient. Next, the final question to number 15. Right, number 15. how many optotypes are there in one row in Bailey-Lowy chart?
5 optotypes. 5.
5 optotypes in one row in Bailey-Lowy chart. Excellent. Give a good round of applause to Team Silver. Right. So we don't take much time. I think the judges, they are calculating the marks. So quickly, shall we move to the round 3? So there will be a fundus photograph on the screen. And this question is for the both teams. So this is fastest finger first. Whoever rings the bell first, get the chance to answer the question. Failing which, the other team will answer. And this will award with minus marks if you give the wrong answer. So the all marks that you all get minus. Okay, for one question, 10 minus. Huh? Right, okay. So, can you put the slides, the first slide on the screen, please? Right. So, Team Silver get the chance. Can you please explain this condition?
That's proliferative diabetic retinopathy. We can see new vessels on optic disc and new vessels elsewhere.
Very good. Give a good round of applause. It's a proliferative diabetic retinopathy, NVE and NVD, neovascularization at optic disc and neovascularization elsewhere. Excellent. So the next. I don't know who rang the bell first. Huh? Okay, I'll tell you. Let's keep this and the next one. That's right. What's this condition?
That's left hypotropia.
Right, wait. This entire condition that you have.
That's third nerve palsy. Third nerve palsy.
Can you, explain what are the things happening in this oculomotor?
Yes, we can see ptosis and inferior temporal eye movement and the pupil dilation in third nerve palsy.
Okay, let's give the marks to that team. It's a complete third nerve palsy ptosis, deviation of eye inferior and temporal side in the mid-dilated pupil. Okay, right. So next. We'll give equally chance to the other team also. Let's see. So Team Gold, get the chance.
Papilledema.
Not papilledema.
Morning glory eye syndrome.
It is morning glory anomaly.
Yeah, the thing is now, you get only one chance to answer. Right? So the other team got the chance. So minus 10 marks for this team and the marks to the other team. So the answer is the morning glory syndrome. So funnel shape, optic nerve, head. All right. Next one. Right? So Team Silver.
Toxoplasmosis.
Toxoplasmosis ka. Very good. Give a good round of applause. So, the other one. Team say loud.
Center retinal brand occlusion.
It's not clear. Yeah.
Superior branch retinal vein occlusion.
It's a branch retinal vein occlusion. That's right. The full marks to that team. You can see a little bit of a macular star also there. Right. All 5 questions we done? Another one more. Okay, they get the chance. Central retinal artery oxygen. Right, all right. So give a good round of applause. And let's see, Vidya, who wants. So whoever wins this competition, I mean, there will be no winners or losers because this is all about active participation. And you will see, all new students will see how actually I would say the comprehensive their knowledge are. So they were, with a short notice, they gathered the team and they prepared for this. So I'm glad. So let's announce the winning team. Vidya, can you come forward? So thank you very much, everyone. Give a good round of applause.
Right. Yes. Right. Chanaka, thank you very much. It's an interesting session, and in the first round and second round, both the team got equal mark. But in the third round, it was a tricky time and situation faced from the both gold and silver team. The gold team won. Actually, they won 20 marks, but due to minus 10, they became a 10 marks out of 50. But the silver team, always they got the plus 10 marks, so altogether 40 marks they have out of 50. So altogether, I would say in the first round, both the team got 50 mark equally. Second round, both the team got 30 mark equally. So at the last round, the winning team is silver team. Thank you.
Please remain on stage. You will get a small token of appreciation.
So we'd like to invite the winning team to remain. Or both teams? Both teams. Okay, fantastic. So truly no winners or losers. Everybody gets to go home with the prize. So we have the prize being brought up right now. Okay. So we'd like to invite our quiz master, also a senior lecturer here at SLOA, senior optometrist Chanaka Veerasundara, to do the honors of presenting these tokens to the participants.
Yeah, so as I mentioned earlier, there's no winners or losers here. These are all together. We done this one because to make a little bit of a difference in this forum. So one team got 10 marks more, but all engaged. So we appreciate everything. So I would say not the winning team, the team which got 10 marks more. So there's a small token of appreciation to everyone. And even for others, we have. So the team who got 10 marks, you all can step down. And we'll give a small token to the other team as well.
And there's a gift for our moderator also.
Let's put our hands together for senior optometrist Chanaka Veerasundara. Thank you very much for such an interactive and interesting session right there. With that being said, ladies and gentlemen, As you will agree, we've had a day filled with interesting insights, and especially our research presentations had a lot to teach us. It's time for us now to turn our attention to the judges who have been observing each of these presentations, and we'd now like to invite them to provide us with their feedback on these presentations as well as a concluding remark from each of them. So with that being said, we'd like to invite, first and foremost, Professor Teekshana Suravira to join us to share a few thoughts. Let's put our hands together, ladies and gentlemen, for our judge, Professor Teekshana Suravira.
Thank you very much. And this was a very hard session for us. And we had altogether 8 research presentations. And out of that, we had really tough time to select one out of, there was a tie case. In fact, you may have noticed, it's okay for me to tell the names. Samita Pattanayaka, comparison of near point accommodation and near point convergence with positive fusional vergence among young adults, Bangalore. That was a very technically impressive research, we agree. And on the other hand, we had another one, importance of considering the notch in glaucoma, Metma Malvatta. So if we were outside, we could have had some fights physical. Anyway, considering several aspects, even that was good, technically good. On the other hand, we had several reasons to take the final decision. Final decision was based on, both were technically good. Final decision was based on how far the outcome can be useful for our opticians in general. So taking that into account, we decided, is it okay for me to tell the, not yet, okay. So those are the 2 things, right. So anyway, all were good research-wise, and we were not allowed to announce the final. So when it comes to poster session, there were very interesting posters. One was about the problems associated with increased screen time. That was a nice one. And a literature review, which is a good one, literature review about expanding the role of artificial intelligence in optometric care, which is a high-end, top-end research, which is also coming up. On the other hand, there was another interesting one, environmental waste. These pieces, even in my home, there are a couple of used spectacles. So I don't know what to do. No, this particular researcher, Imalka Abesena, she has studied on that, which is also interesting. Other ones, what I mentioned, the Ekanayaka and Vitanachi, all have done a lot of other work. I would say all the posters have some meaning to say. Can be improved, no question about it. All can be improved, but I think these are very interesting input, new introduction to the session. We would like next year to see more impactful, useful research as well as the posters. And that's a very good sign that it's moving forward. Because we have seen previous years, this year it has one step ahead. I think that's all for me. Thank you very much. And with a difficulty, I keep my mouth shut.
Thank you very much to Professor Tikshana Suravira. I'd also like to invite the other two judges to join us on stage. We do have tokens of appreciation for each of you. And I'd like to invite our chairperson at SLOA, Senior Optometrist Shama Varjini, to also join us now as we thank our judges for their very valuable contribution in helping us observe as well as give valuable feedback to help our presenters enhance their research work. And of course, our judges have done a very tough task of choosing the winner, who we will reveal in just a short while as well. So here we have our three very worthy, very esteemed and respected judges who have done a fabulous contribution to our scientific sessions. We'd now like to present them with tokens of appreciation. Let's get started with the very first token presented to Professor Tikshana Suravira. And as this is presented, let's put our hands together, ladies and gentlemen, for Professor Tikshana Suravira. Our next token will be presented to mentor optometrist Mangala Edirisinghe. Let's put our hands together for mentor optometrist Mangala Edirisinghe. And we have one more token to another judge. We have Dr. Lakwin Samaranayaka. Your applause, ladies and gentlemen, for all of our judges. And with that, we say thank you very much to everyone on stage. You can feel free to take your seats in the audience. Up next, ladies and gentlemen, it's time now for a presentation from a sponsor. We have Hoya here with us. Allow me to introduce the individual who is representing Hoya today at our gathering. We have Mr. P. Ramachandran, who is a seasoned eyewear consultant in India. He currently serves as a consultant to Hoya Vision Care South Asia, and he also supports India Vision Institute Oro Lab in an honorary capacity. So with that, we now invite Mr. P. Ramachandran to take stage. Let's put our hands together as we welcome him up, ladies and gentlemen.
Good evening, everybody, and I think I never addressed a gathering in the evening in all my life. So I now understand how it feels to address somebody in the evening, and perhaps this is a learning as well for me that I think we need to probably look at timing as something which is also important as we do presentations, and how much we can involve each one and make yourself engaging. It's not easy. So I just wanted to quickly take this opportunity to thank SLOA for giving me this opportunity to talk a bit about Specs 2030, WHO Specs 2030, wherein I'm representing Oro Lab as an honorary advisor on behalf of India. And so I just wanted to talk about the Specs 2030. I am not going to take more than 4-5 minutes. And the only aspect which I would like to talk about is Sri Lanka should be seen as a member in WHO Specs 2030, because we were there in Geneva for the inauguration, and Sri Lanka was not there. So I wish that you should be participating there as SLOA or any other organization who wants to be a member of this particular initiative. To quickly look at what this WHO Specs means, it's not just spectacles. It's basically to increase the effective refractive error coverage by 40% by 2030. That's the objective the WHO has set in. And this involves everybody. This involves optometrists, ophthalmologists, all the other service providers, and so on. So coming to the objectives and the vision is very clear, to basically offer good quality spectacles at affordable prices, but by not compromising on the services which are rendered as well. So this is going to be a very important aspect as when we go into engaging people. And the mission is to support the World Health, WHO had, through the United Nations resolution, had also adapted this in 2030 as an effective refractive error target. So when you look at the focus, is to strengthen the provision of refractive error services in the government sector as well. So I would urge the SLOA to engage with the Sri Lankan government to see how we can work together to be seen at the global front, especially in this kind of a mission. So just to give you 5 strategic pillars, I'm not going to go into details. It's basically to improve access to refractive services. It means that it's not an issue with Sri Lanka alone. It's a global issue. So it's not that it's only for Asia. It's also for any part of the world. Build capacity for personnel to provide refractive services, and this is engaging. It's an ongoing program which needs to be done. Educating the people about the need of eye care is also very important, and then reduce the cost of refractive services is also an important part of it, because end of it we need to also be optimizing our cost to deliver this effectively, and also basically strengthen the surveillance and research. So this is the broad 5 pillars of WHO Specs 2030. And these are the various aspects. They have gone into details. I don't want to get into that at this point of time, but I can tell you this is going to be a very important initiative, which is going to help all the optometrists here in Sri Lanka, because you're going to see that this is going to, basically if we really focus on this, we are going to see, help the people see better as we go along. And that's one of the objectives being optometrists of the nation. So where I see the SLOA or any other organization fitting in it would be in the WHO Global Specs Network. I think you should write to them and see if Sri Lanka can be part of this particular network. So thank you very much for this. And yeah, last but not the least, this is all available today. Quite a lot of information is available in the WHO Specs website. I think many of you should have a look at it. We don't have to actually duplicate what has already been done. And there is a nice download app which is available either in Android or Apple. It's called the WHO Eyes for screening, basic screening. All this can be used when in your practices as well as a basic element to address the uncorrected refractive error. With that, I end the day, and thank you once again. It's always a pleasure to be in Sri Lanka. I've been coming here for quite a long period of time, and I take this opportunity to thank my colleague, my friend, Mr. Dasanta, whom I've been with, who has taught me Sri Lanka for over the period of years. So I'd like to thank him for that, and he has always been a great ambassador for Sri Lanka whenever we used to have meetings anywhere in the world. Thank you very much. So.
Thank you very much to Mr. P. Ramachandran for speaking to us about WHO Specs 2030. With that, ladies and gentlemen, we are now coming to a much anticipated moment of our day, something that we've all been looking forward to, the awards ceremony. Yes, that's right. It's time now for us to recognize, celebrate, and honor some of the outstanding members in our gathering, and also to felicitate the incredible achievements and contributors made by several of our very own optometrists. With that being said, first and foremost, we have an award that will be presented to a very special individual as we thank him for his long-standing partnership with our scientific sessions. Before we tell you who that is, I'd like to invite the presentation party on stage. We'd like to invite the chairperson of SLOA, senior optometrist, Shyama Varjini. We have the chairman of the 17th annual scientific session, optometrist Chaminda Ekanaika, and to reveal to you and to introduce to you the recipient of this particular award, I'd like to invite senior optometrist Mayur Varia, the past chairman of SLOA. So with that being said, may I now have the presence of senior optometrist Mayur Varia. Ladies and gentlemen, let's put our hands together as he joins us up.
We know the scientific sessions and trade exhibition that is organized by the Sri Lanka Optometric Association is by far the largest gathering of equal-minded professionals in primary eye care in Sri Lanka. So it has been customary in such an august assembly for the SLOA to make significant announcements. And today I have been given the pleasure and the honor of making one such announcement. 2007, I believe, when we organized the first scientific sessions, it was on a proposal by this individual who said, let's organize a scientific session for the first time. And I remember distinctly quite a few senior people at that time said, no, it's not possible. We don't have the ability to organize anything of this nature. But single-handedly, he convinced some of us, and we were privileged to be in that organizing committee, which was headed by senior orthoptist and senior optometrist Siku Badu, and we organized the very, very first scientific sessions for our profession. That was way back in 2007. It was at the Fingara Club. And from that little gathering, today we have developed it to what we see today. And right throughout this period of 17 long scientific sessions, one individual who has stood by the SLOA, coming forward, putting his money where his mouth is, and supporting us in any and every way possible. But not only did he support the scientific sessions, but when there was a need for a headquarters for our association, a man who single-handedly once again came forward, and I remember together with this unique individual going and even measuring the place where the headquarters was going to be set up. So once again, he single-handedly, not finding funds, but he coming forward and saying, this is what we require, and therefore he came forward, funded the whole things, and today we very proudly have a headquarters with the lecture halls and so on because of this man. Later on, when we wanted to celebrate the 50th anniversary of the Sri Lanka Optometric Association, once again, quite a lot of people said it's far too expensive, cannot be done, so let's do the usual run-of-the-mill anniversary that we did, that we have been doing. But this man once again came forward and said, no, doing run-of-the-mill everyday things is good for others, but not for the SLOA. And he gave us the leadership to organize the first international anniversary for our association, where we invited foreign dignitaries from the Asia Pacific Council of Optometry and even from the World Council, but he was unable to come due to some other reasons. So a man who has always stood by the SLOA, whether it be with sponsorships, whether it be with advice, or with leadership, which we very, very much require today. I'm privileged and honored to call upon senior optometrist, mentor optometrist, Mr. Dasanta Fonseca on stage to receive a very special recognition of the Sri Lanka Optometric Association. Dasanta.
Well, here we have it, ladies and gentlemen. A very special appreciation to thank him for his long-standing partnership. Mentor optometrist Dasanta Fonseca, the chairman of the Vision Care Group of Companies.
Dasanta, can we have the privilege of a few words from you? Really, gentlemen, a man who has led from the front and shown us the way. Thank you so much, Dasanta.
Thank you, Maher, for that little exaggerated thing. And I'm very happy, actually, to be here today and see the progress of this thing, of one of the first people who has started not only me, the Seiko and Sandaka's presidency. I mentioned his name. He was the president at that time, chairman at that time. So we all got together and did a small thing. Sandaka was a member of Fingara Club, so we had to do it at Fingara. So we did it very small, but today it has grown to such a big level. So I think we are very happy because the younger generation will have a better future in the profession. Thank you very much for recognizing me today, and for the chairman chairman of the SLOA and chairman of the scientific committee. They have a good job, and all the very best for your future. Thank you.
We'd like to invite the chairperson of SLOA and the chairman of the scientific sessions to remain on stage, because we are now going to continue with the rest of the awards. In fact, we've got certificates for a few courses that our optometrists have done, and then we move on to the much more exciting awards, where we also announce who the best paper presenter was, as well as who the best poster presenter was. So let's get started now, ladies and gentlemen, with the Essilor Luxottica Dispensing Optics course, which was the 6th batch. And to do the honors of presenting this, I'd like to invite on stage Mr. Dasanta Fonseca, Executive Director of Essilor Lanka, Mrs. Ananta Lakshmi, Head of Education at Essilor Luxottica, Mr. Piyumal de Souza, Head of Marketing and Sales at Essilor Lanka, and Senior Optometrist Hiran Pereira, Chairman and Managing Director of the College of Optometry and Vision Science. As our dignitaries join us up, these certificates are presented to those who have successfully completed the Basic Dispensing Optics course conducted by the College of Optometry and Vision Science, jointly with Sri Lanka Optometric Association and Essilor Lanka Private Limited during the period February 2024 to August 2024. Let's get started with the award recipients.
First, we would like to call upon Ishanka Dinushi Silva.
Let's put our hands together, ladies and gentlemen, for the recipients. And we will be moving, of course, in quick succession because we've got quite a few of them. As Ishanka joins us up, our next recipient will be Nilukshi Janaki Edrisingha. Put your hands together, ladies and gentlemen. So right now on stage we have Ishanka Dinushi Silva. Well done to you on the Dispensing Optics course. You're part of the 6th batch. We will then be moving on to the next, which is Nilukshi Janaki Edrisingha. Please join us up, ladies and gentlemen. Put your hands together for our recipients of the certificates. We are going to be moving quite quickly. As you know, we are a little behind schedule and we have so many of you to appreciate. So let's have Nilukshi joining us up, and right after that we will have Harsha Lakmal Senaratna. Harsha Lakmal Senaratna will be up next. Let's put our hands together for the recipients, ladies and gentlemen. Up next we have GWSD Vijayawardena. We're going very quickly, so I do hope our recipients are ready. Our next recipient will be MK Kingsley Nishanta Silva. Our next recipient, Sanjaya Varnakuvatta. Okay, we move on. I don't know if Sanjay is here, so we move on to Nomika Niroshini Pereira. Put your hands together, ladies and gentlemen. Nuwantika Sandamali is up next. This is the 6th batch for Essilor Luxottica Dispensing Optics course. Nuwantika Sandamali joining us up next. And right after that will be ASD Tilanka Sampath Senadira. Okay, we move on. MDP Saranga. Move on. Vinuki Sandanika Disanaika. Let's put our hands together, ladies and gentlemen. Dispensing optics course, our 6th batch. We then move on to Viran Chamudita. Okay, next up, PA Nipun Vinu. Well done to you, PA Nipun Vinu joining us up. Next we have AGCM Atura Liagama. Well done to you. Joining next, Hashini M. Abewardana. PAN Prasadika. Nirosha Damayanti Disanaika. Nirosha Damayanti Disanaika. You're up next. Well done to you. Our next recipient, Pemasirige Nishanti. Put your hands together. Come on, let's hear it up for them. The 6th batch of the Dispensing Optics course. We then move on to DL Udesha, Shri Madhurangika Manikama. Joining next, IG Chaturi Subhashini. We then move on, RM Manushika D. Ratnaika. D.A. Sanduni Chaturangi. Well done to you. We're halfway through this list. We then move on, W.A. Sanchla Pires. Mohammad Farhan Muad. Fatima Shabra Farhan. Essilor Luxottica Dispensing Optics course, 6th batch. In fact, we have 42 students to recognize from this batch. And then we move on after Fatima will be PKT Fernando. After PKT Fernando will be SRCTP Gunatilaka. Well done to our students from the 6th batch of the Essilor Luxottica Dispensing Optics course. We then move on, AAC Gayeshka. We then move on to G. Malinda Pabodia. Mariam Farhan. And right after that will be AML YK Vijay Ratna. We then have JM Rushika Yamodia. Sundaramurthy Sangeeta. Well done to you. OGW Varuni Sashikala Piumali. Samira Hashini. Samira's here. Samira S. Kirindage. W.A. Hashini Shanika Dairatna. If Hashini is not here, we move on to Sevni. Sevni Amanetmi Fernando. Right after Sevni, we have Tamasha Pravindi Kuruvita. After Tamasha will be C. Krishant Lakshit. C. Krishant Lakshit. After that, Sandaruan Gomez. We then move on to Nadul Dulsara Edirisingha. Hashini M. Abevardhana. Letmi Sachintani. I do believe that's all of the students from the 6th batch of the Essilor Luxottica Dispensing Optics course. If there's anybody else remaining, we'd like you to come forward. All right, I believe we've had all of the students come up right now. That was the final student on stage for the 6th batch of the Essilor Luxottica Dispensing Optics course. Thank you very much. Let's put our hands together, ladies and gentlemen, for our students. And we'd like to say thank you to Mr. Dasanta Fonseca, thank you to Mrs. Ananta Lakshmi, Mr. Piumal de Souza, and Senior Optometrist Hiran Pereira. We now move on to the next set of certificates. This is the Bosch and Lomb Mastermind in Contact Lenses, 3rd batch. To present these certificates, I'd like to invite the following to join us. Mrs. Jayashri Sekhar, Professional Service Manager, South India for Bosch and Lomb India. We then have Mr. Biswas Janardhan, Country Head Sri Lanka for Bosch and Lomb. Mr. Dasanta Fonseca, Chairman CEO, Global Vision Lanka Private Limited. We then have Mr. Suranga Kumara, Relationship Manager at Bosch and Lomb. Senior Optometrist Hiran Pereira, Chairman and Managing Director, College of Optometry and Vision Science. And we have Senior Optometrist Shama Varjani, the chairperson who's already on stage. So with this, we get started with Bosch and Lomb Mastermind in Contact Lenses. And these students have successfully completed the training program conducted by the College of Optometry and Vision Science, as well as SLOA, jointly with Global Vision Lanka Private Limited and Bosch and Lomb University. Let's get started, ladies and gentlemen, with M. Mohan Raj. Put your hands together for our students. We then move on. Annadasan Sujeevan. Okay, we move on. DMHK Disanayaka. WAD Tanya Miladet. Shanika Vitarana. Yes, we have our student here. Let's put our hands together for Shanika. Well done. WWM Camilla Fernando. We then move on. SP Ranjana. And right after that will be WM Nilanti D. Veragama. These are the Bosch and Lomb Mastermind in Contact Lenses, 3rd batch. We have 28 students to recognize in this segment. So we have right now Camilla Fernando. SP Ranjana is up next. And right after that will be WM Nilanthi D. Veragama. We then move on to Muhammad Nalir Marikar Naveed Marikar. Well done to you. Let's put our hands together, ladies and gentlemen. These are the students of the third batch. Bosch & Lomb Mastermind in Contact Lenses. Right up to this, we have LN Shamila Chaturika. Well done. Let's put our hands together. Joining next, MC Sudarshana Pereira. We then move on to K.A. Sitara Sulochani Pereira. Well done and congratulations. Third batch, Bosch & Lomb Mastermind in Contact Lenses. Next up will be Manatunga Sitika Himash Silva. Next, M. Sinet Silva. We then move on to B.A. Nadij Nihara. Nadij Nihara, if you're not here, we move on. M. Chamal Rangika Jayawardena. Next up, K.A. Sujiva K.K. Pereira. 28 students in this batch. Joining next will be Tamasha Kavindi Kuruvita. Joining next, Dulara Pereira. We then move on, WMK 70. Amanetmi Fernando. Yes, let's put our hands together, ladies and gentlemen. Third batch, Bosch & Lomb Mastermind in Contact Lenses. We have just a few more students to recognize in this batch. ID Vimalanath is up next. Well done. EH Charit Harshana Vikramaratna. DM Dhananjaya Vidana Arachi. WAD Tanya Miladet. HSP Ajit. Jansi Jayasilan. The last few names to go in this batch before we move on to the next segment. Let's have Jansi, followed by WMK 70 Amanetmi Fernando. S.K. Palyaguru. So these are our wonderful students in the third batch for Bosch & Lomb Mastermind in Contact Lenses. The last two students right now, and then we move on to the rest of the awards segment. Let's put our hands together for them, ladies and gentlemen. Many months of effort has gone into this program, so well done to all of you who've deserved your certificates this evening. And that brings us to the end of this segment. We'd like to say thank you very much to Mrs. Jayashri Sekar, to Senior Optometrist Hiran Pereira, to Senior Optometrist Dasanta Fonseca, to Mr. Biswas Janardhan and Mr. Suranga Kumar as well. Thank you very much to all of you. Of course, we have our SLOA chairperson who will stay on and the chairman of the scientific sessions who will stay on. We are now moving into the poster presentation certificates. To do the honors of presenting this, I'd also like to invite on stage mentor optometrist Mangala Samarakon and mentor optometrist Dr. M.H.C.J. In. All right, we move on now. This is the segment where we present certificates of participation to those who have taken part in the poster presentations. And here we go. Let's get started with Mallika Dilhani Agalavatta. Let's put our hands together, ladies and gentlemen. There she comes. And once again, we are moving in quick succession. Next up, Chaminda Ekanaika. Madhuka Atukorala. K.A.D. Janita Sanjaya. M.G. Buddhika Silva. H.M.G. Sashini Aishwarya. So we have Buddhika joining us up next after this. All right, we have Buddhika will join us next. Following Buddhika, we will have Sashini. After Sashini, Chintani Deshika Vitanachi. Do we have Chintani here? We move on. Sajika Ekanaika. Janani Jeevaratnam. Following Janani will be HPGP Udayakanta. HPGP Udayakanta, Asuni Immalka and Abe Sena. Asuni Immalka and Abe Sena. MSN Pires. MSN Pires. Nirasha Preeti Ratna. Nirasha Preeti Ratna. Nimesha Kalpani. Nimesha Kalpani. Nuwan Madhushankar. And with that, we'd like to say thank you very much to mentor optometrist Mangala Samarakon for joining us, madam. Thank you. We then move on to the next segment where I'd now like to invite mentor optometrist Suranjan De Silva, senior optometrist Sandaka Lenagala and mentor optometrist J.U. Sikobadu to join us up. We are now going to be presenting certificates for those who have presented new innovations at the annual scientific sessions. So these are the certificates for new innovations. Let's get started with the certificate of participation. Optometrist Nuan B. Senaviratna. Following that, optometrist P.R. Anton Frank De Silva. Optometrist U.L. Patmasiri Senaviratna. Mr. Chulananda Gonçal Korala. Optometrist AADP Sudarshani. Mrs. Tanuja Vijayananda. Optometrist DJW Abhay Gunaratna. DJW Abhay Gunaratna. RMN Ranavira. Optometrist RMN Ranavira. Mr. Oshan Vijay Surya. Oshan Vijay Surya. Rajiv Pushparaja. Rajiv Pushparaja. Menaka Kumarage. Menaka Kumarage. And then we also have Foundation Course 10th batch. Foundation Course 10th batch. Also receiving a certificate. Foundation Course 10th batch. I believe we have all of the participants for new innovations who've come up. We then move on from innovation to instruments. Certificate of participation for instruments. We'd like to say thank you very much to mentor optometrist J.U. Sikobadu. Thank you, sir. I'd now like to invite senior optometrist Chanaka Veerasundara, senior optometrist Anura Rajakaruna to join us up. Senior optometrist Chanaka Veerasundara and senior optometrist Anura Rajakaruna. We'd like to get started with the certificate of participation for those who have presented an instrument at our annual scientific sessions. Starting with Mr. C.G. Gunasoma Diataripu. You are our first recipient. Senior optometrist Shama Varjini from Law Vision 8. Optometrist Chamindrani, optometrist Shiomi, optometrist Romala, optometrist Geetanjali, optometrist Raghuvaran from Golden Key Hospitals Limited. Optometrist PM Priyanti De Silva, Law Vision 8. Law Vision Clinic, National Eye Hospital, Sri Lanka Eye Donation Society. So these were the certificates of participation for those who presented instruments at the annual scientific sessions. Hopefully we've had all of them joining us up. We're now moving into the next segment. With that, we say thank you very much to our presentation party. We're now down to the last two awards for the evening. The last two awards, ladies and gentlemen, and that is Best Paper and Best Poster. To do the honors of presenting these final two awards, I'd like to invite Dr. Karpagam Damodaran and Senior Optometrist Timothy Frick to join us up right now. The final two awards, and I'm sure we're all eagerly waiting to find out who the winners are for the Best Paper and the Best Poster. So, without further ado, ladies and gentlemen, Best Paper at our 17th annual scientific sessions. The award goes to optometrist Metma Malvatta. Congratulations. Here she comes, the best paper that was presented at our annual scientific sessions this year. Well done to you, optometrist Metma Malvatta, now proudly being presented the medal. Ladies and gentlemen, let's put our hands together for optometrist Metma Malvatta for the best paper presented at the annual scientific sessions 2024. And now for the final award for the evening, the best poster. And the best poster has been presented by Asuni Imalka and Abesena. We have a special gift from AOMC also being presented to the winner of the best poster. So we have a wonderful gift coming your way. This is Asuni Imalka and Abesena with the medal, as well as a gift being presented to her. The best poster at the annual scientific sessions 2024. We have a gift for you. Please, Asuni, wait on. We have a gift coming your way as well, in addition to the medal. I'd like to invite the head of AOMC to join us up, Mr. Lalit Vijayavardhana. So we'd like you to please join us. Please wait while we have Mr. Lalit joining us. Asuni, please wait. We have the head of AOMC. And with that, this is the best poster for the 17th annual scientific sessions. Let's put our hands together, ladies and gentlemen. Asuni Imalka and Abesena. Thank you very much to our presentation party. With that, ladies and gentlemen, we're almost coming to the end of the formal proceedings. Before we wrap up, it's time now to take the opportunity to say a big thank you to everybody involved in making sure that this annual scientific sessions has been a noteworthy event. So to do the honors of delivering the vote of thanks, I have my fellow MC as well as the secretary of these scientific sessions. Let's put our hands together for optometrist Savinda Samrakon.
Thank you very much, Shreshma. Phew. It's been a long day, guys. Okay, so we've come to the final part of the 17th annual scientific sessions. I'm not going to take too long, but I do have to thank a lot of people for helping and assisting to making this event an absolute success. So it's going to be a little bit of a long list, but please bear with me because I do have to mention all of these people. First and foremost, a special thanks to our chief guest, Professor Sepalika Sudasinghe, for her invaluable presence today. Despite her demanding schedule, she's taken time to spend time with us, and we're truly grateful. We are also immensely thankful to our guest of honor, Dr. Amila Dialwis, for taking time from his busy commitments to grace this event with his presence. We all know his participation always elevates the session, so thank you so much for being here. I would like to extend our gratitude to Senior Optometrist Timothy Frick for coming all the way from Australia to participate in the scientific sessions. Your insightful presentation has been both enlightening and informative. Thank you for your valuable contribution, and we hope this marks the beginning of a continued collaboration in the future. And of course, a very special thanks to Dr. Karpagan for interactive presentation and making these sessions truly remarkable. It's an absolute honor, Doctor, to have you again, with us again, sorry. Your continued support and willingness to share your knowledge are deeply appreciated. And we hope to welcome you back once again. Dr. Karpagan, this is all for you, by the way. Thank you very much for being with us. And you also know what drives us here in Sri Lanka. It's always the LKR. Thank you to our guest speakers, Mr. Shankaram, Ms. Anant Lakshmi, and Ms. Jayashree, who shared their invaluable insights. Thank you so much for flying down and spending your valuable time with us. I would like to extend my heartfelt congratulations to our research presenters for delivering outstanding presentations for their research and case studies. Your contributions have truly enriched the essence of our scientific sessions, and it has brought depth and meaning to this event. Thank you very much for your hard work. A big thank you to the session chairman, starting from Mentor Optometrist Ranjan De Silva, Senior Optometrist Gwen Gurusingha, Mentor Optometrist Sandaka Lenagala, Senior Optometrist Kumari Jayasingha, Senior Optometrist Mayra Varia, and Senior Optometrist Rani Abesekara for your leadership and in conducting the session so effectively and smoothly. A special thanks to our panel of judges, Professor Theekshana Suravira, Mentor Optometrist Mangala Edirisinga Samarakon, and Dr. Lakwin Samaranayaka for their dedication throughout the entire session. Thank you so much. We must not forget our sponsor partners, without whom this event will not be possible. A special thank you to Mr. Nilan Fernando and the Solex team, our supreme sponsor, for going above and beyond and elevating the standards of the session. We cannot forget our most long-standing sponsor, Essilor Luxottica and Global Vision Lanka. Thank you to Mr. Dasanta Fonseca, Mr. Janaka Fonseca, and Mr. Puma for their continued support. We also extend our sincere thanks to Mr. Lalit Vijay Surya and his team from AOMC, our silver sponsor, for their generous support. Likewise, we are grateful to Mrs. Mala Vili and her team from VNI Vision Center, along with Mr. Gayan Marasingha, Dr. Samantha Ananda, and Mr. Rajiv Kotial, and their team from Hoya, our bronze sponsors. Thank you to iEquip for part sponsoring the valuable power bank, which you would have got in your little takeaway bag. Additionally, I would like to express our thanks to all the trade stall partners who've joined this year. Your vibrant displays have truly made the trade exhibition colorful and exciting. And I trust your participation has been mutually rewarding. A big thank you to Lahiru, who did his best to come up with the Q&A app. I know it was not a success, so we had to put it back. The organizing committee will decide on what we're going to do for the prizes. We will give it away. It's just that we have to decide on whether we're going to have one more round or we're going to just select the winner from the first rounds. We will inform you shortly. Most importantly, to the organizing committee, the chairperson, board of directors, and dear volunteers, your hard work behind the scenes has made this event a smooth experience. From the planning stages to this very moment, your dedication has been nothing but remarkable. Organizing an event in this magnitude is not an easy task, and only a very few people can rise to the challenge. But year on year, one person takes the lead consistently, and he surpasses expectations every single year. Our scientific session chairman, Optometrist Chaminda Ekanayaka, your hard work and commitment do not go unnoticed. Thank you for your unwavering leadership and for continuing to inspire all of us. And we cannot forget our hardworking admin team behind the curtains, been working day in and day out, trying to make sure that this event goes smoothly. Thank you to Mrs. Niroshini, Mrs. Vijayanayaka, Mr. Vinod, and Mr. Imran for their incredible efforts and hard work. I would also like to thank the Monarch management for allowing us to have this event. Lastly, I would like to personally give a big shout out to all of you, our audience. You all have been great. Thank you so much for being here and being patient with us. It's been a long day, but we truly appreciate your participation and your attention. On a lighter note, I would like to also thank my fellow compeer, Trishma. I think the organizing committee would have realized by now, hiring a professional is the way forward. Once again, ladies and gentlemen, thank you very much for being here. We have come to the end, and I hope to see you all next year when we will raise the bar once more. Until then, thank you, and we'll see you at the fellowship.
Thank you very much to Savinder for those warm words of gratitude expressed to everybody involved in ensuring our scientific sessions have been a success. With that being said, ladies and gentlemen, we are now coming to the end of our formal proceedings. But remember, we've got plenty more fun in store for all of you. Very shortly, we will have, of course, entertainment and cocktails and fellowship and dinner. Before that, of course, there's a session by our supreme sponsor. So I will now hand it over to Solex Enterprises to take it forward. But from me, Trishma, I'd like to sign out by wishing you the very best. And I do hope you enjoy the rest of your evening. Thank you, ladies and gentlemen, and have a nice day.